everyone. Welcome so much to Ask the Doctor. My name is Shamira, and I am with Grapevine Health. As Grapevine Health, we are a health media company, and our mission really is to deliver relatable, easy to understand health information that you can trust. And one of the ways in which we do that is with our Ask the Doctor sessions. So we want to give you a chance to ask your health related questions right now, wherever you are, and making sure that you can get answers that you feel good about. Today, we are talking about kidney health, and in honor of Men's Health Month, we've partnered with the Alexandria Fairfax Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. Before we get started with our questions, you'll notice a QR code on your screen. That QR code, if you take your phone and scan it, will take you to a quick 5-minute survey. This survey is really just to help us improve our health literacy programs over time and make them even better for you. So if you don't mind, please take a quick moment to complete that survey. And if you are a Fairfax County resident, you have an opportunity to get up to $40 for completing that. All right, back to today's event. So let me introduce our special guest. First up, we have our moderator, Mr. Riley Jacobs, and he will be helping to get your questions answered and keeping the flow of conversation going. Next, I want to introduce our expert. We have Dr. Keith Melanson, and he will be the one answering all of your questions. So I do not want to take up any more time. I will give them both an opportunity to tell you a little bit more about who they are and what they do. But if you already have questions, no worries. Just type them into your chat box, press send, and they will come directly to Riley. So with that, Riley, I will pass it over to you.
Thanks, Shamara. And once again, thanks for allowing us to participate in what we consider another event involving men's health that we take very, very seriously. I'm a member of Alexander Fairfax chapter of Kappa Alpha Psi Fraternity Incorporated, and I hold another distinction. I'm one of the what we call Golden Heritage members, which means I've been in the chapter and in the fraternity for over 50 years. And as such, we have a keen interest in men's health, especially for our older members. And I think we have about probably 35 of those. Before I actually introduce Dr. Keith, this is supposed to be a fun event this afternoon. A little levity would be appropriate. So I'm going to impart to you a very quick story having to do with the welcoming process. There's a gentleman who liked to fish, and he didn't have a lot of luck, but he actually went out on a fishing trip and was highly successful. And he actually was so successful that he filled up a cooler with fish, some even live. So he brought these fish home, and he ultimately determined that he wanted to show them to his wife and let her know what had happened. So from the garage, he went upstairs immediately. Excuse me. When he got to the bedroom, though, he opened the door and he was shocked. From under the cover, he saw a man's feet and a woman's feet. He closed the door very quickly and tried to contemplate what to do next. So in his mind, a lot of things flashed back and forth. So he determined, okay, I know what I'll do. He went downstairs and he grabbed his cooler full of fish, and he went back upstairs, muscled it upstairs, opened the door, and then threw the fish inside on the bed, closed the door, and listened for the screaming and shouts that came from within the bedroom. Kind of downtrodden, he went back downstairs. On the way going downstairs, he heard a sound in the kitchen. So he walked into the kitchen. There sat his wife at the kitchen table with a cup of coffee. She said, "Oh, hon, you're home." She said, "Your mother and father decided to drop by, so I gave them our bedroom. I hope you welcome them properly." So I'd like to continue this discussion with a welcome to our major participant and our major presenter for this afternoon, Dr. Keith. Dr. Keith?
I loved your story there, Mr. Jacobs. So thanks for I'm looking forward to our discussion this afternoon. I'm a transplant surgeon. I transplant organs when people need them, either kidneys or livers or pancreases. But I've been interested for a long time in access to care. we're talking about men's health this month, and access to care and by not having good access, wind up dying prematurely, pressure, diabetes, kidney disease, heart disease. These are all things that could be properly treated if we had better access to care. And it's for this reason that I'm happy to be here this afternoon, because giving people information usually is the first step toward them becoming better educated on ways of making their health better. So thanks for having me.
This afternoon, we have a number of questions that we'll be posing to Dr. Keith. Just a reminder, these are designed to be very general questions. We're not providing medical advice or anything of that nature, but there are a whole bunch of questions that people have, they want answers to. And so as we go through this afternoon session, Dr. Keith will be addressing those appropriately. And we're going to start with a very basic question, Dr. Keith. I guess the question is, what do kidneys do, and why are they important to us?
Yeah, it's a great question, and it's one I get quite often. And your kidneys are basically the major filters of your body. Most of us are born with two kidneys, although you could, survive with just one. But what the kidneys do is they take all the blood from your body and it filters out all of the toxins. So the kidneys, along with the liver, take out all of the toxins that build up in our bodies. And toxins build up in a variety of ways. Every cell in your body, every organ, it produces old cells that break down and need to be regenerated. And this produces toxins, and it has to be cleaned. Every time you eat or drink something, there are certain toxins that have to be removed. And your kidneys remove fluid and toxins from the body. In addition to that, there are proteins and hormones that come from the kidney that are important. And again, it's impossible to live without properly functioning kidneys, or at least a substitute for properly functioning kidneys, like dialysis. If your kidneys are not functioning well, it's incompatible living. And that's why we need to do everything possible to keep our kidneys functioning.
A related question to that, you mentioned dialysis. Over the past years, I've been associated with a number of pretty much senior people who went on dialysis. And we know that it's an important medical procedure. It's actually critical to their survival. And they actually, in some cases, had good outcomes and not so good outcomes. So I'm going to ask a two-part question. Number one, what's the importance and significance of dialysis? And number two, this is a question that comes up quite often. It seems that in some instances, people undergoing dialysis, especially some senior people, may have some very adverse reactions to the actual process. The process has been around a long, long time, obviously. So my second part of the question is, are there any improvements in the actual dialysis process that can help sort of mitigate some of the adverse impacts on people receiving the treatment?
Yeah, you were breaking up there, but I think what I heard is, are there any improvements in the way dialysis is done? And then the second part of the question is what I didn't get. But let me just go through what dialysis is. Unfortunately, there's a lot of kidney disease in this country. Millions of people have some sort of kidney disease. There are 5 stages of disease, and in the stage 5, that's stage kidney disease, and that means that are hurt, how people find themselves on dialysis. Acute kidneys and be only while your kidneys recover. Okay, so those get to have to be on dialysis. Dialysis is so important is because if you get to that stage 5 where your kidneys are not functioning and they're not going to recover, the only way for you to stay alive is if you are receiving dialysis. What dialysis does, dialysis tries to kidneys do normally when they function normally, and it comes pretty close. The only difference between dialysis and having good kidney function is that dialysis isn't quite as good as your kidneys. So they never can totally recoup all of the function that your kidneys do, but it will keep you alive. Dialysis does about 15% what your kidneys do, but it's enough to keep you alive. There are different types of dialysis, which is what most people receive, and that means you have to have a needle stuck into your arm and your filter in order to clean it. Or you could have what's called peritoneal dialysis, which is where they put a catheter in your abdomen and then the fluid goes into your abdomen and then it's removed. And that's another way to receive dialysis. So the important point I want to make is people sometimes don't understand that if your kidneys get to the point of failure and you're on dialysis, it's the only way for you to stay alive. If you need dialysis because of kidney failure and you don't receive it, die over time. So dialysis becomes very important for people that need into community. And what we're trying to do is alert people or prevent kidney disease so that they don't need dialysis. If you need dialysis, you must have it live.
And Doctor Keith, also a follow-on question to that. The second part of that, it may have been breaking up. Are there any technological or medical improvements to the dialysis process at this particular point in time?
Yes. Okay. Thank you, Mr. Jacobs. Yeah. So over years, there have been some improvements in how dialysis is done. Dialysis hasn't really been around for that long of time because it really wasn't until the 1960s that dialysis became available for most patients. And over that time, what has improved markedly is the way we receive dialysis. In other words, it used to be that in order to receive dialysis, you had to go into 3 times a week and sit in that center for at least in order to get dialysis. What's improved markedly in the last few years is dialysis is done at home, and that usually means put it in your bedroom, and it connects to a tube in your abdomen, and while you're sleeping, you can receive dialysis. So that's those machines have improved a lot over the last decade. And so that's why and flush this catheter. You don't have to do that any longer. You can just do the dialysis at what has been dialysis. If you go back 10 years ago, it really wasn't that available to do hemodialysis at home. But now, and in both much, is a much better and a healthy way to receive dialysis rather than having to go inside of a clinic 3 days a week. So I think that's the biggest improvement over the other big dialysis or for end-stage kidney disease patients is that the medication, when filtering, that's a problem, but the chemicals that's produced by the kidneys. And those chemicals suited for medication, and those medications have gotten a lot better. The medications um, blood count goes in chronic anemia patients have gotten better. So the medicines are better, machines that you utilize, and I think that's the biggest technological improvements that have happened in the last 10.
Dr. Keith, another question came in, which actually you've explained quite a bit about the dialysis process and its importance. But this came in as sort of like a fundamental question, though, and
While
I think you may
I'm
have touched.
waiting at, we focus a lot on trying to prevent
Okay, can everyone hear me? I believe we are back from resolving our technical difficulties. If that's correct, let's do a little check here. Are we back online?
Hi, hello everyone. Yes, we are back. We are live. We are getting started. Thank you all so much for holding with us as we fix our audio. This is such important information, and we want to make sure that you can hear it all and hear it all clearly. So let's get right back in. We have time left, so let's get to as many questions as possible. Riley, I'm going to pass it back to you, and you can get us started.
Okay, thank you very much. Dr. Keith, I think you were explaining some of the technological pretty much advances in dialysis very quickly. So if you could actually restate that for our audience.
Yes, yes, Riley. Basically, what I was saying is that there have been a lot of improvements in dialysis over the last few decades, and the main improvements have to do with the fact that now dialysis can be done very effectively at home. And I think in the last decade, that's been the biggest improvement. You can do peritoneal dialysis at home. There are machines that will circle all of the fluid through your abdomen overnight while you sleep. That's an improvement. And then the other big improvement is that there are small hemodialysis machines that you would have in your home. And you can do the hemodialysis 3, 4, even 5 days a week at home. And therefore, the type of dialysis that you get when you do it at home is much more effective. So I think that's the biggest improvement. And the second uh, big improvement in the last decade has been that the medications that one would require, because their kidneys are not working, medications to lower their calcium level, which is always high in kidney failure patients, medications to lower their phosphorus and potassium, and then medications that actually increase their blood count. These are all things that kidney failure patients require. These things have all improved over the last decade. I think those are the biggest improvements technologically and medically for dialysis patients in the last few years.
Dr. Keith, I'm going to circle back to a basic question that came in. And we've talked a lot about a very critical treatment for actually kidney disease, and that, of course, is dialysis. One of the fundamental questions that came back here a couple of seconds ago is a fundamental understanding of kidney disease, how you can contract it, and also, second part to that question, are there any underlying medical conditions such as diabetes that may also impact your ability to take care of yourself properly with kidney disease, or even ward off the disease?
Yeah, yes. Thanks, Riley. Those are great questions. And what we need to understand is that three major causes of kidney disease. Number one, diabetes. Number two, high blood pressure. And usually people with kidney disease have a combination of those two. And then number three, obesity. And again, obesity usually impacts your blood pressure and your tendency to develop diabetes. So those are the three major causes of kidney disease. And if you have any or all of those problems, it definitely impacts your overall health, even beyond the kidney disease, because every single part of your body, every organ, every vessel, every cell of your body is impacted by these systemic problems, meaning that your entire body is malaffected by having obesity, high blood pressure, and or diabetes. So one of the things I tell people, when I'm out in the community is that there are things you can do to decrease the chance that you have these three problems. Obviously, for obesity, lose weight, increase your activity. Increasing your activity also decreases your chance of being a diabetic, because most diabetics are what we call type 2 diabetics. That means that you have diabetes primarily because you're overweight, and losing weight decreases your chance of having diabetes and can reverse diabetes, particularly if you combine the weight loss with increasing your activity. And then the high blood pressure, which is key, because so many people have actually been diagnosed with high blood pressure and don't have it treated appropriately. They either don't have any treatment, or they will take a medication and the medication does not make their blood pressure go into the normal range. So it's important for people to understand what it means to have a normal blood pressure. A normal blood pressure means that top number needs to be less than 140 and the bottom number needs to be less than 80. If it's not there, you have high blood pressure, and therefore you have a risk of all these problems, not just kidney disease, but heart disease, stroke, on and on. So it's very important for people to have normal blood pressure. How do you know you have a normal blood pressure? Well, you can go to a local drugstore and buy a blood pressure cuff. They are, less than $20 now, and you can just take your blood pressure, and it needs to be in the normal range. These are the things that people need to be doing to prevent kidney disease, Riley.
Dr. Keith. Um, there are actually tests that are performed when people go get their physical that are sometimes not all inclusive. For example, personally, I didn't know there was such a thing as vitamin D deficiency. And I learned it because a nephew had that particular problem. I simply started taking vitamin D, but that came out as a result of a physical exam I actually had. And the doctor said, oh, yeah, here's what you need to take, and this takes care of the problem. What type of questions should a person ask their physician during a physical exam about their kidney health?
Yeah, again, excellent question, Riley. And this comes up a lot, and I definitely think it's important. It's imperative that people are informed about what to ask their physician. So, number one question should be, how does my kidney function look on my labs? And usually, the physician can look at your blood work and determine if your kidneys are functioning normally. So that should be the first question. The second question should be to probe your physician to see if they're looking for early kidney disease. And early kidney disease is not detected by a blood test, it's actually detected by a test of your urine. So, what you want the physician to be able to tell you is, do you have a lot of extra protein in your urine? If you have a lot of extra protein in your urine, that's a sign of early kidney disease. So that's something specific to ask your physician to make sure that they are looking for early kidney disease. The third thing that's important, and it's probably one of the most important things, is you want to compare your labs at your visit to your labs at your last visit. Most people, unless they have an ongoing illness, see their physician once a year. Well, you want to know, have your labs changed since your last visit? Because your labs can be in the normal range, but they could be moving toward the abnormal range in the last year. And that's another way to pick up early kidney disease, is if your labs are moving in the wrong direction. So it's important for you to ask those questions and be informed about your own health. You should keep a copy of all of your lab results and be able to review them for yourself at home to make sure that the physician or the physician assistant is addressing all of your concerns?
I have a follow-up question. I think you probably answered that to a great extent, having to do with as you go through the process and you've been diagnosed with having a kidney problem, what types of tests or what type of vigilance does the doctor provide for you that shows your kidney health is deteriorating? I think you probably answered that question by saying it's important to compare your visit information so that you know what's happened between the time you were there before and this particular point in time. I
Yes.
have a, go
Yeah.
ahead.
No. Yes, you're absolutely right. That's what I was getting at. And many hospitals now, they usually give you access through a computer portal where you can go and look at your labs yourself. And again, you should copy them and keep them in a file with all your healthcare information, because you got to be proactive about your healthcare. I can see in the chat here that there was a follow up to your earlier point, Riley, about you not knowing that you could possibly have vitamin D deficiency. And the question is, why are African Americans more likely to have vitamin D deficiency? And the reason I bring it up is because vitamin D is important for kidney health as well. The reason why we as Americans have more issues with vitamin D deficiency is because our skin is darker, and vitamin D is a, is absorbed from the sunlight. So the lighter your skin, the less likely you are to have a vitamin D deficiency if you are out in the sun. So if you spend a lot of time in the sun and your skin is lighter, you are less likely to have a vitamin D deficiency. If your skin is darker, you spend a lot of time indoors, then you are more likely to have vitamin D deficiency. And that's why it's more of an issue for darker skinned people.
To my particular situation that was asked by another participant today. Uh, as we look at men's health nowadays, we are confronted with a number of issues relatable to the health of Black men. I mentioned before, I think briefly, that we had a segment on by a gentleman by the name of Alfred Anderson about prostate cancer. And it was basically a documentary film he had produced called A Black Walnut. I also mentioned that we actually had a health fair not too long ago when the chapter really sponsored not just men, but also everybody in the local community adjacent to our facility to come on board and get checked. We also have a very elaborate and extensive men's health committee within our organization that looks at these types of things. So it's very important to make sure that as Black men, we are looking at not just the kidney aspect, but the complete picture of our health across the board. In that regard, one of the things that I think has been asked is, as Black men, we tend to sometimes have a lot more stress than other people, Black women also. So what role does stress play in the ability to keep your kidneys healthy?
Yeah, great question. And a germane question in so many respects. First of all, let me start with the cultural issue, because when in my career, we've done studies looking at cultural differences between groups of people by ethnicity. And in our culture, African Americans, particularly African American men, we tend to keep a lot of things inside, including problems with our health or concerns of our health, or even going to the doctor and getting treated for issues. So that's part of what needs to be broken down when you start talking about cultural issues. We as Black men need to understand our health is important, and we need to be open about discussing our health, not only with healthcare professionals, but with our family, because it's going to impact how people prepare food for us and how they care for us, and understanding what we may need. So that's one of the things that needs to happen. When you start talking about stress, it's very important, and it has a huge impact on kidney disease, because stress has a huge impact on blood pressure, and your kidneys release a hormone that actually modulates your blood pressure. And when you are more stressed, the kidneys and this little gland right next to the kidneys called the adrenal gland. The adrenal gland, the official name of the adrenal gland is called the suprarenal gland. It sits right above the kidney, so they're very intimately associated. And when you are stressed, your adrenal gland and your kidneys release more of these hormones that happen to drive up your blood pressure. So, absolutely, when you start talking about things like having to deal with prejudice, having to deal with pressures that others don't deal with, it actually helps to drive up your blood pressure. The other thing the stress hormones will do over time is it causes you to seek comfort in different ways, like comfort foods, and actually crave more sugar and salt. Again, this is a problem because one of the ways that people can deal with stressful situations is by ingesting things that are unhealthy. I remember my father would always, when he was stressed, he would eat ice cream. So that's another way that stress negatively impacts our health. But numerous studies have shown a link of people that are dealing with prejudice of increasing their stress and making it worse. So you are absolutely correct to make that linkage between the stress that we exhibit or experience in society and how it affects our health.
with high blood pressure, with a whole bunch of other things. You mentioned the fact that we have an ability to seek out comfort foods in certain situations. And I guess we all kind of have that. I'm going to ask one other question relatable, and I think you've answered the question about issues relatable to diet. What about alcohol consumption? Does it play a role or a factor in the increased likelihood of having a kidney disease?
Yeah, absolutely. Because alcohol, in and of itself, is not poisonous to the kidneys. It's not like the liver, where alcohol itself is poisonous to the liver. So it directly impacts on liver health, and we've all known people that have had what's called liver cirrhosis, where their liver has been attacked year in and year out by high alcohol levels. You don't have the same thing in the kidney. It's not that alcohol directly kills kidney cells, but what alcohol does indirectly is it dehydrates people. So chronic dehydration can can be toxic to the kidneys indirectly, because what happens is people can abuse alcohol and then also abuse what's called non-steroidals. So the same people that oftentimes are drinking lots of alcohol are taking a lot of medications like ibuprofen or goody powders, things that have a lot of non-steroidals inside of them to deal with the sort of headaches that you may receive from drinking a lot of alcohol. The toxins that's inside of alcohol have to be excreted out to the liver and the kidneys. And when those toxins build up, they tend to give you things like headaches. You take headache medicine, and the combination of a lot of alcohol, dehydration, and headache medicine can lead to kidney disease. The other problem with alcohol consumption is, a lot of extra sugar as well. And studies have been done showing that African Americans not only drink more alcohol, but tend to drink more sweeter alcohols. And again, that more sugar is more of a problem for obesity, for diabetes, and it impacts your vascular and kidney health. So it's not a good thing to drink lots of alcohol on a chronic basis.
Dr. Keith, we probably have time for one more question, and I'm going to pose that particular question to you. I'm going to put it in terms of a scenario involving me personally. I was overseas stationed in Germany, and I had a sudden chronic back pain that would not go away. I was admitted to the hospital, and they did tests, but it was excruciatingly painful. And being in the hospital for a couple of days, it kind of halfway went away. And then it came back as if somebody had attacked my back with sledgehammers. I was diagnosed with a kidney stone. The problem with the kidney stone is I had something called an opaque kidney stone, which did not show up on the actual x-rays themselves. But I was told at that particular point in time, one of the key things to sort of mitigate kidney stones in the future is to basically consider hydrating and drinking plenty of water. That happened to me many, many years ago, and I've kind of followed that routine. And so far, I think it's worked. I wouldn't not recommend anybody go through that. But do you have any insight about where we are now in this country relative to Black men and kidney stones?
Yeah, yeah. Again, another great point. You asked great questions, Riley, and it was apropos that you talked about your kidney stone, the alcohol question, because they go hand in hand. Remember when I talked about alcohol consumption, what is problematic about alcohol consumption is that it can dehydrate you. And usually when people have kidney stones, it's always some level of dehydration. It's an over concentration of certain ions in the urine. So it's not only what you eat, but it's what you're eating plus the fact that you're dehydrating yourself. So like you said, what you're doing in order to prevent this from ever happening again is you are drinking lots of water. And that is usually the solution, is to drink lots of water. Now, what we will do if someone has a history of kidney stones, you actually can look inside their urine. You can get an analysis of their urine to find out what their kidney stones are made up of. And then you can give them a specific diet about what to avoid. Like if you have a calcium oxalate stones, which are not opaque like yours, but they do show up on an x-ray, but you would have patients avoid, oxalates in their diet. And there are very specific low oxalate diets. And you would do the same thing with people that have high nitrates in their stones or whatever. But the point is, the most important point is what we were talking about before, which is to not dehydrate yourself. So you need to be careful about drinking lots of coffee, lots of teas, lots of alcohol, because these things can lead more to kidney stones. And yes, we do see them in our African-American patients. And usually that's the advice. Decrease the alcohol, decrease the dehydration, increase the water in your water consumption, because that's going to increase kidney health across the board.
Thing I would say is that probably an hour was not long enough to do this. These have been very informative questions, and I know we've actually had a lot of things that we've actually had people ask that we may not have a chance to address. If people have additional questions for you, can they contact you via your website?
Yes, they definitely can. They can go on. I am the director of what's called the Ron and Joy Paul Kidney Center, which is housed at George Washington University, which is where I am employed. So you can go to that website, the Ron and Joy Paul Kidney Center, and ask questions, or you can go to George Washington University and look up the kidney transplant program, and I can be asked questions there. I would just respond because there's a question here that I see that I think it's important, where they ask about fast food and what we should be avoiding. Are there certain types of fast food? And what I would just say in blanket terms is that we should be avoiding high salt foods. So all Americans, but particularly African Americans, we eat too much salt in our diets. So we should never add salt to our food after it's cooked, and we should not add much salt while cooking. We can add other spices, and we should avoid fast food primarily because there's way too much salt and preservatives in all fast food. So we really should be avoiding fast food, period, except for rare occasions, but definitely not as a regular part of diet. We should be eating food that we cook at home.
Keith, this gets us close to the end of our session today. And first of all, I'd like to personally thank you with a yo, because this has been very informative, and this allowed us to address a lot of questions that we may have, but we don't have a forum for getting those questions answered. We'd also like to ask that your information be posted in the chat room by Grapevine Health so that people can contact you personally. I'd like to personally thank the members of Grapevine Health for putting this on. As I mentioned, we are less informed than we need to be as we go forward, considering what's happening not only socially, economically, but politically in this particular country, to not only Black men, but also to the Black population in general. So forums like this are very, very important to us, and we try and actually get the word out. But unfortunately, we are only a small entity in a big pond, and as much as we try, we are not actually, I guess, reaching the people we think we should be reaching. Once again, on behalf of the Alexandria Fairfax chapter, Kappa Alpha Psi Fraternity, and Dr. Keith, I'd like to thank you for your participation this afternoon. And again, if you have questions, we'll be getting the information out in the chat room. With that, I'd like to say thank you very much, and I'd like to turn it back over to our Grapevine host.
All right. Well, actually, before we hop off of here, since we did have technical difficulties for a little bit, I want to make sure that we just give people a couple of more questions to get those things answered. So, Dr. Keith, if you can stay on with us for just 5 more minutes, I know there were two important questions that came through that we would love your feedback on.
Sure.
And so, one of the last questions we have here is, what can I eat to help me take care of my kidneys? And we touched on what not to do, but can you leave the people with something? All right, what am I supposed to do? How can I get this together?
Yeah. Well, I noticed someone made the point, and I think it's a very good point of cooking from scratch. The, the way foods were created, they're good for our bodies, period, but good for our kidneys as well. So, lots of fruits, lots of vegetables, and even meat. If you get into the point of being on dialysis, that's a little different. But meat can be consumed in a healthy fashion, particularly lean meats. So you want to avoid things like pork, but lean cuts of beef, chicken, goat, lamb. These things can be consumed in smaller portions. But primarily, what you really want to do is you want to eat a lot more vegetables and a lot more fruit, and then drink lots of water. This is what is the healthiest way. That's the healthiest way for us to consume food. And we want to avoid what we talked about. What we should avoid: preservatives, fast food, that kind of stuff. But cooking at home, cooking with lots of spices. I mean, spices are good for us, but we want to avoid salt. So you want to get rid of salt, but bring in lots of spices. You can cook almost anything from a vegetable or fruit or even legumes. But again, you would want to buy your beans at a market, a farmer's market, maybe. Buy them whole and fresh rather than canned beans, because they have lots of salt. So that's what I would tell people to avoid: the types of food that hurt your kidneys or hurt your bodies overall. Just eating fresh food, fresh vegetables and fruit, you will find that you tend to lose weight and have less swelling. And this is better for your kidneys a long term.
Thank
And I can't state it enough. I've said it already, but water. That's what's in this cup. Lots of water. Water is the best thing for your kidneys.
Absolutely. Thank you for that. As a dietitian, it is a topic near and dear to my heart. So I could not agree more. Healthy eating does not have to be boring. It does not have to not have flavor. There are so many herbs and spices and things that you can add that aren't necessarily salt, but still give you that punch of flavor. And as you said, those things like getting more of your lean proteins, your vegetables, your fruits, all of those things that we see not only help you with your kidneys, but help you stay healthy overall. Last question, I promise. It is Men's Health Month, and we are honoring that. So, is there any tip that you want to leave with the people joining, especially our Black men, to help stay healthy and just be mindful of their health?
Yes, and I'm a black male myself, and I know because I have the same issues. We need to take care of ourselves, and we're so used to doing things for others, for our profession, or in order to provide for our families, or even when we entertain ourselves. But what black men need to understand is that they need to focus on their health. One of the questions that came up was about the stress of being a black male in this society, and that is very real, and it impacts our health. And therefore, we need to be vigilant in trying to de-stress, right? So whatever it is that you do for fun, you want to be able to do that on a regular basis to de-stress. And you need to understand that it's okay to discuss your health with your friends, with your family, and definitely you need to have a good relationship with your health care provider. So I know how difficult it is for men in general, but particularly black men, to have these open sort of conversations. But let me tell you, it is the best way for you to understand what you need to be doing to get healthier. And then we need to just do it. One of the problems that I see, because again, I'm dealing with people at the end of their healthcare journey sometimes, they just haven't listened. Lots of black men get diagnosed, particularly with high blood pressure, early in life, and they don't get it adequately treated. And here's one of the main reasons. One of the main reasons African American men do not get their blood pressure adequately treated is because they take a medicine that causes impotence. And what, and then they just kind of give up on it. And that's really not what should happen. What should happen is, of course, you don't want to be impotent, so you should go back to your doctor, tell him that this medicine is not working for you, get another medicine and try it out. Literally a plethora of blood pressure medicines. But once you need to have that conversation with your healthcare provider and go through whatever combination works for you, and then get your blood pressure in the normal range. So many of us have problems, and it all goes back to blood pressure. It's really one of the major issues that we as black men deal with, and this is something that can be treated. So the de-stressing and the healthy lifestyle thing, those are all things that are good and fine, and we should be doing them because long term is the best way to deal with things like even high blood pressure. But acutely, we need to take the medicine until we can deal with it on a long-term basis by changing our lifestyle. And that's what black men need to understand. And if the medicine doesn't work, get a new medicine. But you got to keep following up, and you got to make sure that whatever therapy you're getting gets your blood pressure in the normal range. And what is the normal range? That top number, systolic, needs to be less than 140, and the bottom number, diastolic, needs to be less than 80, period. And if it's not there, you are at risk of stroke, heart attack, and kidney disease.
All right, what a great note to leave us on. And I just want to reiterate what you said. I know there can be some hesitancy about going to the doctor or finding a care provider that works for you. But when you do go, if something is not working for you, you have full permission and authority to share that information and say, hey, I need something different. You are empowered to do that. You don't have to just accept any kind of care that you receive. You can say, no, my health is important. This is not working. I require something different. So, with that, I want to personally thank both Riley and Dr. Keith for joining us today and really having an impactful conversation about health, healthcare, kidney, and men's health overall. So, thank you to you both for all that you have done for us here today. And thank you all for joining. Thank you for joining this Ask the Doctor session. This is only one of many, so please follow, subscribe, and connect with us on our social media channels to stay up to date, not only on our next Ask the Doctor event, but all of our great content. You can find us on social media at Grapevine Health, or you can visit our website at grapevinehealth.com. Special thank you to the Fairfax County Health Department for supporting today's event. And don't forget that QR code if you want to complete the survey and you haven't gotten a chance to yet. So thank you for joining, and I appreciate you on behalf of the Grapevine Health team.